So let's talk a little bit about research evaluation. What exactly is research? For those of you at this age, at this stage in your career, you probably haven't even really thought too much about, could research even be a career interest for you? I know at your age I did not. So when I was an undergrad, I really had no idea what went into the idea, the aspects of conducting research. But research essentially is the evaluation of anything, basically. I mean, it's a wide range of areas that could be studied, but specifically what we're talking about relates to biomedical emphasis, particularly in my field, nutrition, dietary supplements, exercise. These areas that I've studied different interventions over almost the last 20 years or so. But the idea is that you take an idea, you have an idea, you think, okay, does this work or not? Basically, that's the fundamental question that you're asking, and that's regardless if you're using cells, tissues, humans, animals, whatever the case may be as your test subject, but then implementing an intervention or a treatment is typically the most broad way of thinking about research. There are obviously more specific things that you can drill down into and get much more detailed about, but basically the idea is to collect research or to conduct research is to ask a question, and then after the experiment is over, evaluate the information that you garnered from that study and then see if you can say, yes, it works, no, it doesn't. That's really what research is all about. So now that we have an idea of what research is or why we should do it, let me take you through a series of steps, if you will. Again, you're probably at this stage, at this age, not really even thinking about research. You may not really even know what that means to go to, say, the library, pull a journal, and start reading an article and to be able to understand what you're reading. So I hope to give you just sort of an overview of the steps that you'd go through to really understand what research is on the other side. So I showed you the BRM4 product. This is a product that's made by a company in Japan. We've studied this product pretty extensively over the last 10 years. And the whole genesis of this actually came from a patient here at the university who had also metastatic cancer, was basically given a death sentence, and then she started taking this product, and sure enough, it gave her another 8 or 9 years of life. So as you can imagine, she was a very strong proponent of the ability of this product to do work, to actually be beneficial for her. And so she put me in touch with the company. Now, there are lots of different avenues and angles to go down this line of research in terms of how research gets funded, how you actually do research, where you actually do research. We've had the benefit of being here at a university where you have a large infrastructure that helps to support people like me who do research, but you may have a company that conducts research. I mean, there's certainly lots of companies out there that do private research. So there are lots of different avenues and angles with which to conduct research. But going back to this product specifically, so once I got in contact with the company, they were very interested in having research conducted here in the United States. Now think about this for a second. This is a company in Japan, and they're selling a lot of their product in Asia, as you can imagine. But in an interest in having more of a market penetration in the United States, what they really need is to have science that's conducted here in the United States. If you don't know this already, we definitely have sort of a bias or a supposition about things that are conducted or done in other countries, but we feel safe, we feel secure if something's done here domestically, then we feel better about it in terms of whether something works or not. And that's not necessarily true for a dietary supplement. That could be true for clothing, cars, jewelry, anything that any kind of consumer item that you might consider purchasing. So the company's interest was to have their products studied here at a top-tier university like the University of Miami. My interest, of course, was the fact that I had had this patient contact me who was such a proponent, such a huge advocate for this product. And so she was very committed to the idea of seeing what this product would do and how it would be once it was studied. Now, other investigators had already been studying this product in different countries throughout the world, but again, a lot of the emphasis the company had at that time was expanding their reach within the United States market. So I guess from that point you could say, in terms of how it affected me, it was just good timing, it was a gift, it was whatever you want to take it as, something that happened for me in my life. It sort of took me down a little bit of a different avenue. So once I started the negotiation process with the company, we came to an understanding of sort of an outline over a 5 to 10 year period from that point of where we wanted to go with this product. And so one of the things that we wanted to do was to simply say, not only does this product, can this product work, can this product actually be effective, but is it safe? So there are actually markers that we can look at to determine safety in a product, because one of the things you might imagine with a dietary supplement is it safe? And so that's obviously a very basic question that needs to be answered. And fortunately, through the standard scientific method, we can do that. And that's one of the reasons why we conduct biomedical research, not only because we want to know if something is effective, but we also want to know if something is safe. So this is a paper that we published. This is the first paper actually that we published with this product, and we did show that this product happens to be very safe. So we look at different ways that this product affects the liver and the kidneys. Those are the two primary ways that you would assess a product's safety, and in fact all the markers came back pretty much normal. Now we looked at people who were generally thought of as being healthy. These were not people with cancer or diabetes or heart disease or HIV, something serious or significant, but we wanted to start out with this study in healthy adults, and that's in fact what we did. So the safety data were shown to be true. There was no problem there. And then we also had the real benefit of showing that this product is very significant for the immune system. So as it turns out, there's a concept called immunomodulation. And what that simply means is that this product has the ability to modulate or affect the immune system in a very positive way without overstimulating it or without suppressing it. So the results of our natural killer cell cytotoxicity or activity, which was our primary area of interest in this study in addition to the safety data, showed true immunomodulation, meaning that the immuno response, the natural killer cell cytotoxicity response, went up after 1 week of being on the product. And then again, because these were within healthy people, these were not people again who were sick with a chronic disease or a life-threatening illness, the product showed that the natural killer cell response went back down. So quite frankly, we could not have drawn this graph any nicer. I was really, quite frankly, amazed that we got the data that we got from the study. And you'll notice the two different graphs here, the two different lines here. The red one is taking 3 grams of this product per day, and the blue one is taking 1 gram of this product per day. Now the statistically significant finding of going from baseline to 1 week showing this nice increase in the cytotoxicity actually was no different regardless of if you were taking 1 gram or 3 grams per day. So what we showed within healthy people is that it really didn't matter if you were taking 1 or 3 grams per day, you still had the same kind of immunomodulatory response, and then going back down basically even a little bit below baseline at 60 days. So it was a short-term study. This wasn't meant to, look at this product over years at a time. But what this enabled us to do was have very solid science to show that this product actually does something. So going back to one of the earlier objectives that we talked about, structure-function claims that companies can use under the Duché Act of 1994, data like these are very important for companies to be able to make such claims, because again, this is showing that this product has a specific effect on our natural killer cell functioning. Our natural killer cells, by the way, are one of our primary first line of defense against any kind of an invading pathogen into our body. So whether it's a bacteria, a virus, a fungus, anything like that, our natural killer cells get turned on, and they are the first guys that go out to fight that, whatever that is, again, bacteria or a virus. So having something like this as part of our armamentarium against all these insults that we face from the environment every day, to have something like this to keep our immune system response healthy and regulated properly is very important. So Going back to the research evaluation component, basically this allowed us to then take the next step, and so we went into another study that actually just in the last few months we've finished the data analysis. We're almost ready to submit for publication, but we looked at the effect of this product with people who have HIV, which is no longer considered the killer that it was back in the 80s and 90s. But certainly it is still a significant healthcare problem today. It's still costing us lots of money. There are lots of people who are affected by HIV. And so it's a disease that now is regulated basically the same way or managed the same way as things like type 2 diabetes, hypertension, high cholesterol. It basically now falls in that same class of disease. So it's costing us a lot of money, and it's also crippling people in a way that affects greatly their quality of life. So we looked at that. We looked at the product in terms of its ability to help people deal with HIV as an ongoing chronic situation. So the data came out very strong, very nice in terms of helping people to boost their immune system, to modulate their immune system. So what we're doing is showing a series of data, a series of steps, which helps to explain the research process, because now you've gone from this study, which was within healthy people, to now going into a disease state to be able to help understand the true potency of this product. And again, it's not just the work that we've been doing here at the University of Miami, but we have colleagues from all around the world, particularly people in Japan, but also in other countries in Asia and Europe, where also this product is being studied and showing time after time that the data are so impressive, and the way this product has an effect on the immune system, particularly in helping people with cancer and things now like HIV, that you begin to see consistency within the findings. And that's another important point in research evaluation, is being able to show consistency. If you can replicate the findings, or at least simulate the findings of other investigators, and again, I don't have any connection to the other institutions in Europe and in Asia. These people are showing things independently just like I am, and this is all coming together as a very consistent message that time and time again this product is showing its true effect, its ability to dramatically impact the immune system's functioning. Now you begin to see validity and consistency, and these are things that are also very important in being able to evaluate research and to say, does something like this work? So when you create a body of work over a period of time, now this goes also back to the point that I was making about what's the difference between a good and a bad dietary supplement. Well, unfortunately, most companies are not doing like Daiwa, this is the name of the company, Daiwa Pharmaceutical, in terms of supporting their product through research, through investigators like myself. Unfortunately, most companies don't do this. But when a company does do this, it gives you that assurance, that credibility factor to say, well, they must be very confident in what they're producing, or otherwise they wouldn't be spending this money to conduct these studies. And by the way, that's another point that I should mention is, unfortunately, this research evaluation, all of this research takes money. And so the university can subsidize some of that. The university can provide buildings, office space, laboratory space, maybe sometimes even staff that will help to conduct certain tasks. But unfortunately, we as investigators are also expected to bring in funding to help support this research. So this is another aspect of research evaluation in terms of where do you get your funding to be able to do science. Fortunately for me, the company has been willing to fund these studies. This isn't something that we have been subsidizing 100%. So when you have the opportunity to work with a company who has money in their R&D budget, in their research and development budget, to be able to do these types of studies, then again, this is what is the interplay between commerce or industry and academia, is to be able to combine the sources together to be able to create a research body over time. So looking at this larger body of work, again, this is not just our laboratory here, but also combined with all these other folks around the world, now you can begin to show a pattern, and this is where the validity element takes over in terms of being able to say, okay, well, this is far different from saying there was just one study in one period of time that showed something, but then you have nothing else. But with this particular product, not only, again, do we have our studies we've conducted here, but we have other studies we can compare them to around the world, and now you have this body of literature that you can then say, okay, what looks very consistent over time? And as you can show consistently, and again, it takes time to do this. This isn't something that you can just snap your fingers and overnight or within, say a few months' time, you have this level of information. But after a number of years and after dedication and lots of hard work over time, then you can say, okay, with fairly good certainty, we know this is a good product and we know this product works. So that just gives you a little bit of an idea of how this product has gone through scrutiny on many different occasions with many different investigators in universities and institutions all over the world. And time again, it still shows the beneficial effects that it has on the immune system and ultimately on the subject's quality of life and their health status. So this is why that I say that this is one product that you can be very certain of having a good chance of working for you if you not only want to prevent disease from happening in the first place, but if you unfortunately do already have a health challenge, that you could take something like this to help you recover and help the body repair, restore, and heal itself. So this gives you just sort of an overview of how we conduct science, and within this context of using BRM4 as an example of using this product for human research that we've done here, although other investigators have used this product within animals, again showing very consistent results to what we've seen in humans. But this product has been evaluated many times by many different investigators, so it gives us a level of certainty and comfort that this is a very good product that we can use for our health. After we've conducted our study, you might be asking yourself, well, how do you get that information out to the larger world? It's one thing if you're at a university or in a company, in a private company, you're conducting all this science, and then you make some really significant discoveries. But then what? How do you get that out to the consumer? How does the person on the street learn that BRM4 is this an amazing product, but yet they would never hear about it? So we have what's called the peer-reviewed process, and this is a journal. I've published in this journal. And the peer review process basically means that you have peers, that's what peer means, peers, colleagues, people at your level who review your work, and then they say, okay, well, this is valid, this looks legitimate, you have the backing of the institution, in this case the University of Miami, and then you're able to disseminate your information through journals of this type. Now, this is different from a magazine that you would buy on the shelf in a grocery store or Barnes & Noble or at the drugstore. This is again a peer-reviewed journal where you have people scrutinize and read over all the work that you've done. Many times they ask you questions. They want to know, well, how did you do this? Make a correction on that. I've gone through this many times. I've actually published quite a bit in my career, and so I'm very familiar with how this works. But this is basically the main way that we as scientists and investigators get our science, our results, our findings out to the world. And then if we're lucky, if we're fortunate, we make something really amazing, something that really contributes to human health through biomedical research, then sometimes the news will actually take things that are published in the peer-reviewed literature, and then they take it to the mass media. So that becomes even at a much higher level where people discover the work that's been done at research laboratories or at private institutions. So again, this is the way that we focus our research into a document or a manuscript that gets published in the peer-reviewed literature, and this is the primary way that we disseminate our information to the world.